Hello everybody, this is Dr. Tyler Evans from Arete Chiropractic coming at you live with the research moment today. Today we are talking about a very involved topic. I'm going to try to do a brief overview and just explain some of the statistics about risk of stroke and chiropractic. And you know, there's a lot of people that oftentimes come in this office and say, hey, you know, I heard from such and such that you know, a chiropractor might cause a stroke when adjusting the spine or the neck. And today what we're going to talk about is how there is no increased risk from seeing a chiropractor outside of the fact that someone is already having a stroke and they've gone to a medical professional. So I'll break it down, but there's no increased risk, and that's very important for people to understand. It's important for even healthcare providers out there to understand. There are many doctors that are either, you know, medical or, you know, in other professions across the board that may not understand that, and even chiropractors that don't understand how to explain this, what's called an association, not a causation. There are two great papers done, one was done in 2010, one was done in 2016. The first one done in 2010 was on the risk of vertebrobasilar artery stroke, and the second one done in 2016 or 17 was the risk of carotid stroke. So there are two arteries that feed the brain. So if we look here, yeah, let's use this one first. So if we look here, we've got the aorta here coming off the heart, and then it comes up, and there are these two large arteries that come up right up the middle, right here. Those are called the carotids, and then little ones branch off called the vertebral arteries, and then they turn into the basilar arteries right here and then right here. Got it? And they feed the brain, and that's important because honestly, that's how your brain stays alive. It needs oxygen and it needs nutrition, and it gets that from the blood. And when there's a break in that blood flow, the brain can't function. It literally chokes out. It can't breathe, and it needs that oxygen 100% and the energy to make the nerves fire. And when there's no oxygen for a period of time, that's called ischemia. It's literally like choking. You know, it's like tying a finger, you know, tying a band around your finger, and then you look at it and it turns, you know, purple and dark red and purple over time because it literally chokes off that blood supply. So when we look at the brain here, you can just see how much the brain is vascularized by these arteries. It's literally just like fingers going through everywhere and feeding every lobe and bump and you know, piece of tissue in the brain, because it's constantly sucking energy and oxygen to go. It's the biggest energy suck in our body. It uses a vast amount of the energy that our whole body uses. Most of it is used by our brain. It's kind of crazy, but it's true. It's real. And so this is a picture from the bottom up. So here we have that, you know, that side-on picture here as you can see that here's the spinal column. The vertebral artery runs up and then into the base of the brain and feeds the base of the brain, as well as that carotid artery. It's actually the carotid, if you look here, is the larger one and feeds 80% of the blood supply to the brain, and the smaller one, the vertebrobasilar artery, it goes and feeds 20% of the back of the brain. The carotid feeds the front of the brain. And so this is just a picture real quick here of what happens in a what we call a insufficiency. So the you know, this is in the carotid here. So you can have what's called a clot or a plaque, and that can fill the artery, and it can lodge itself so much that the blood can't flow up. The heart can't push it up. And so you start to have this decrease. And as it decreases, it starts to cut off the blood flow. And so you can have two things happen. One, you can have the ischemia. So ischemia is one, and that's literally where it's choked off right here. That's from a clot. And then you can have a rupture, hemorrhagic stroke. And that's a more serious deal. And that's where the bleeding literally just bursts into the vessels, into the tissue around, and that artery ruptures. And unless you get to a ER and call 911 and get to the ER quickly, that can be prolonged problems and possibly even death. And so when we look at this paper here, got my stack today. That's so many things I want to talk about. What is a stroke? So a stroke occurs when the blood supply to an area of the brain is cut off. It depends on which artery or what branch of the artery, depends on to what part of the brain. So, and then what is affected. So it could be motor, it could be sensory, because sometimes people lose motor function. They have drooping of muscles, they can't lift their arm, a leg doesn't work, or they have sensation loss, so they have numbness and possibly pain, and that's those are the sensory areas that are affected. And so there's one thing that we learned in school, and I think it's kind of a quick and easy breakdown on what to look for in a stroke. So it's called FAST, F-A-S-T, the signs to remember. And this is called, FAST is face drooping. So if they're smiling, right, and they can't smile even on both sides, that's a problem. That's the muscle weakness. And then arm weakness, so arm, A, that's the A in FAST, arm weakness, that's a problem, right? And then speech, difficulty with speech. They may slur their speech, they may not be able to speak at all, they may not, they may be mumbling weird words that you can't understand. And then the last one is T, is time to call 911. And really, this is not a place for anything other than going straight to the ER, right? Call 911, go right to the ER. So that's FAST. And then we also have these other, there's 14 other things that can happen with stroke. Weakness or paralysis of any part of the body, numbness or pins and needles, sensation anywhere in the body, numbness or pins and needles sensations anywhere in the body, gait disturbances, so trouble walking, wobbly walking, loss of balance and coordination, vision changes, blurred vision, dizziness, severe headache. So it's called a thunderclap headache. It's not a headache that you would get from being out late too late last night, or from working too hard at work. It's not even a migraine. It's literally a thunderclap headache. It's the worst headache of your life, and it's denoted like that. So that's something to look out for. And then confusion, inability to speak, slurred speech, loss of sensation in any part of the body, memory loss, behavioral changes, muscle stiffness, difficulty swallowing, and then involuntary eye movement, so moving of the eyes. So those are 14 things to look out for, as well as that FAST, face, arm, and then what was the S? Speech. Yeah, face, arm, and speech. And then so those are the kind of quick signs and symptoms. Now, if we talk about these two papers here, and I don't want to take up too much time today, but I want to hit this because this is really important. So the first paper done in 2008, 2018, 2008, it came out in 2010. There were 818 vertebral-basilar artery strokes of people that were hospitalized in a population of more than 100 million persons, 100 million person per year. That's weird. 818 people in a year, basically, in a hospital. So in those aged greater than or less than 45 years, cases were about 3 times likely to see a chiropractor or a PCP before their stroke than the people that were controls. Now, what does that tell you? That tells you people under 45, they might be looking a little bit harder at these things in their life and be paying attention more, and so they go get checked out. So that's all that's saying. So it's not that it's an increased risk, it's that people are worried, and so they go to a chiropractor, they go to a medical doctor. So it's really, really important for chiropractors and medical doctors to know and understand the signs and symptoms of stroke so that they can be properly referred to the ER. It's not saying that chiropractors or medical doctors cause strokes. There was no increased association between chiropractic visits and vertebral-basilar artery strokes in those older than 45 years. It does say positive associations, not causation, associations were found between PCP, primary care, so medical doctors, and vertebral artery stroke in all ages. Practitioners billed for headache and neck complaints were highly associated with subsequent VBA stroke. So people with neck pain and headaches were associated. Practitioners visit billed, yeah, so they were associated with those having stroke. Then the vertebral-basilar artery stroke is a very rare event in the population. The increased risk of VBA stroke associated with chiropractic PCP visits is likely due to patients with headache and neck pain from VBA dissections seeking care before their stroke. We found no evidence of excess risk of VBA stroke associated chiropractic care compared to primary care. So what it's saying is that there's no increased risk from going to a chiropractor or a medical doctor for that matter, and it's actually the same. So you are just as likely going to a medical doctor to be experiencing or having a stroke than you are to be going to a chiropractor. So it's the same risk. So we're just talking about levels of risk, right? And I'm going to get into risk assessment here in just a minute, because that's a big thing that I think most people don't think about or talk about. And so I just want to cover this other paper that was produced in 2017, published in, or 2016, published in 2017, risk of carotid stroke after chiropractic care. So that's the big one in the middle. Population-based crossover control study. And this was a huge study. We aim to assess the risk of carotid artery stroke after chiropractic care by comparing association between chiropractic and PCP visits and subsequent stroke. It was a 9-year period in Ontario, Canada, of all incidences of carotid artery stroke admitted to hospitals. Cases serve as their own controls. Exposure to chiropractic and primary care services were determined from health billing records, so they looked at the records as post case. So we compared 15,000 cases to 62,000 controls, so huge study in windows of 1, 3, 7, and 14 days prior to the stroke. So positive associations were found for both chiropractic and primary care visits and subsequent stroke in patients less than 45 years of age. Again, people under 45 experiencing these symptoms probably, you know, they stress out about it and they go to get checked out. And I think the younger generation tends to seek out care quicker, just from what I see in practice. And then these associations tended to increase when analyses were limited to visits just for neck pain and headaches, same as the last paper. So they're finding the same things, right? So this is very reproducible. It's repetitive. We see this pattern. in the literature. This is in PubMed. This is in the literature, the medical literature. There was no significant difference between chiropractic and primary care practitioner risk estimates. Risk is the same, okay? Same. We found no association between chiropractic visits and stroke in those 45 years of age or older. We found no excess risk of carotid artery stroke after chiropractic care. Associations between chiropractic and PCP visits and stroke were similar and likely due to patients with early dissection-related symptoms seeking care prior to developing their strokes. This is in PubMed. This is in the medical literature. It's well documented. These are huge studies, very well done. And yeah, if you have questions, please reach out. The links for the papers are in there. And just quickly, I want to go over risk, because this is something people come into the office all the time and they ask me this, because we're upper cervical chiropractors. We focus on the upper neck. There's a paper that done by Bo Rochester and Kirk Erickson and a handful of other people. I think it was like 90 upper cervical chiropractic clinics got together and did a huge cohort where they looked at risk associated with upper cervical chiropractic care, and they found in 1 million upper cervical corrections, 1 million upper cervical adjustments in those providers in all their years of practice, not one adverse event or death from upper cervical corrections. That's in 90 offices in 1 million more adjustments or corrections to the upper neck. So let's just talk about risk here, okay? I played soccer and football as a child. I never rode a motorcycle. I've never taken a contraceptive, but a lot of people do both of those things. I've skied many times. I've drank maybe enough wine to have a good night. I wouldn't say a bottle of wine, you know, on live on YouTube or on Facebook, but it says drinking 1 bottle of wine per day. Driving, lots of people do that. I do that every day. Smoking 2 packs of cigarettes per day. I don't know anyone that does that, but that's definitely going to get you into trouble. Professional boxing, we all know that that's not good for you, even though many people do it. Taking NSAIDs, right? Advil, Aleve. How many people take Advil and Aleve a day? And how many people go to the hospital stay? And then at the very bottom, chiropractic manipulation. So this is really cool. I'm just going to pop this up here. So, and I'm going to read the stats here. So soccer and football, 1 in 25,000 risk of death per person per year. Taking contraceptives, 1 in 5,000. Motorcycling, 1 in 50. 1 in 50. Skiing, 1 in 430,000. Drinking 1 bottle of wine per day, that's alcoholism and will get you into trouble really quickly. That is 1 in 13,000. Driving a vehicle is 1 in 6,000. Smoking 2 packs of cigarettes per day, that is 1 in 200, and that's pretty obvious. Professional boxing, again, 1 in 14,000, so you're actually more likely to be injured in a driving accident than being a professional boxer, but hey, we all drive to work every day, it's cool. And then taking NSAIDs. How many people come into my office and they say that they've taken Advil and Aleve that day? 1 in 2,500 deaths per year, per person per year. Hospital stay, 1 in 200. How many people go to the hospital? 1 in 200. And then a chiropractic manipulation is 1 in 7 million. Million with an M. Huge, huge number. And that is you know, putting it in perspective there. So then if we look here, this one's quite interesting. So how safe is medicine, okay? We have 106,000 Americans die each year from drugs prescribed by their medical doctor. 106,000 Americans die each year. Okay? New England Journal of Medicine, 1999. 16,000 deaths each year just from NSAIDs, from Advil, from taking Advil and Aleve. Let's see here. And then 2 in 100 mortality rate for spinal fusion surgery. I mean, I've got many patients in our office here. We have many patients in our office here that have gone for spinal fusion surgery, and they are either told by their medical doctor or they themselves are worried about seeing a chiropractor. Yet 2 in 100 of them may have died on the table in spinal fusion surgery because it's very risky, especially in the cervical spine. So just saying, just putting it into perspective, right? Because that's your perspective determines your philosophy, determines your perspective determines your choices determine your outcomes determine your life. So, you know, just understanding, okay? Here, number of events per 10 million people in the US. Death from spinal fusion surgery, 200,000. Okay? Deaths from cervical neck surgery, 68,000. Death from hospital mistakes, 60,000. Death from laminectomy. Now, all the way down at the bottom here, it says stroke from chiropractic adjustment. And again, we know that that's not a causation, but a association. So 2 people went to the chiropractor in number of events per 10 million. In 10 million, 2 people went to the chiropractor and they were having a stroke, and the chiropractor did not get them to the ER fast enough. And that's on the chiropractor. I get that. You know, you need to diagnose and see that that is a stroke, and you need to get them out there. But how many patients come in our office with numbness in the face or drooping of one eye? That's a big red flag, and a lot of times we will say, how long has that been like that? Look at, you know, let's look at that. Let's go get a MRA. There are many ways to diagnose these things, but you know, we see a lot of these patients with these problems because that's the upper cervical spine. That's part of what we do. So it's really important to you know, understand the risk and put it all together. I think the last 1 or 2 things here is medical malpractice. So how much do we pay in our malpractice insurance year? We pay $3,000 a year, Dr. BB and I. We pay $3,000 a year. So if you look at the dollar per doctor here, the insurance providers, they know how much to charge their doctors. They know how much it costs, right? They know the risk. So if you look at these dollars, we pay $3,000 a year. 3,000. That is nowhere on this list. The number is nowhere near that, right? So internal medicine is somewhere around probably like, I don't know, what is that, 20,000, because that's 100 right there. Look up here at orthopedic surgery, no spine. This is not including the spine. That's shoulder, knee, hip, and $400,000 a year. Neurology, even neurology, that's $50,000 a year probably, right? Like somewhere, you know, maybe 40, 30 on the low end. Ophthalmology, that's maybe 10, right? General surgery, 350 possibly, right? So just look at the numbers, right? Like, let the numbers tell you the story, right? And if you look just at medical malpractice by type of practitioner, this was from, what year does it say? Does it say? No, it doesn't say at the bottom, but oh, it says right there, 2004 to 2014. So that's 600,000 cases. Here's the physicians, MDs, and DOs. That's 182,000. 270 was nurses. Chiropractic was right here. Tiny little guy. 9,000. You know, technicians, assistants was 30,000 nearly. Or 26,000. Pharmacy was 20,000 right here. You know, so anyways, just look at the risk. There is no increased risk from seeing a chiropractor for stroke. There is an association that people having strokes go to chiropractors because the symptoms are the same as what a lot of times people go to a chiropractor for, headache, you know, really bad headache, neck pain, numbness and tingling, arm weakness. You know, these things are what chiropractors see people for, musculoskeletal complaints. So it's just really important to understand that it's in the medical literature. It's very well documented. These are huge studies. And if you have questions, please reach out. We're happy to answer. We're happy to talk about it. It's very clear. There is no increased risk from seeing a chiropractor for stroke of the carotid artery or the vertebral basilar artery. So again, Research Live moment. This was a long one, but this is a big deal. This is a big topic, and I hope it helped. And I look forward to the next time. So have a great day, guys, and we'll see you later. This is Dr. Tyler Evans from Arete Chiropractic. Have a great day. Bye-bye.